you touched on it slightly. You said about calcium, but let's talk about what can happen in this situation if you continue down that road for years taking these types of medications. What are we depleting from our body and what problems can it create?
Sure. I mean, there's numerous nutrients. Just some main ones are calcium, magnesium, B12. It can even affect iron absorption. So if we're talking about calcium, again, when you're not absorbing the calcium, calcium is meant to be in the bone and the teeth. When you don't have enough of it there, what your body wants to do for other functions in the body, it's needed for insulin production, for muscle contraction. When you don't have enough, it actually starts pulling from the bone to go into the soft tissues to start having the effect. And then that's the expense of, then you have a breakage. So sometimes it's that, sometimes it's even just a little side note, sometimes people take calcium supplements and it's not that they are needing it per se, they just need to put the calcium in the right places. And so going back to the depletion of it is, so talking from a diabetes standpoint, calcium is needed for actually causing the pancreatic beta cells to actually secrete insulin. So when you don't have enough calcium, it is not there to push that insulin out. So as blood sugar rises, the insulin's meant to secrete to kind of get that imbalance. If you're not getting the right amount of insulin secreted, that's where you get that gap in the blood sugar. And so in addition, you need magnesium. So magnesium and calcium, they kind of work hand in hand. So magnesium is also depleted with PPIs, but magnesium actually works to kind of inhibit the secretion of insulin from the cells. And so when you look at them in a ratio, when you have a high calcium to magnesium ratio, when calcium's, well, let's go to low. So when it's low, then the magnesium, because it's inhibiting that, is not allowing that insulin to get secreted. Plus the calcium's not there to push it out. When you have the opposite, some people, because you're having too much calcium and you get a lot of insulin going into the bloodstream, they initially may have low blood sugar, but it gets to the point where you actually get bombarded with so much insulin, and calcium is actually kind of a calming agent. So it also, when there's too many things going on, it likes to kind of cover the cell and not let things in. So then what it does is it desensitizes the cell and doesn't allow that insulin to get in. So that's kind of another topic. That's actually something that's called calcium shell. But I'm going to work backwards here for a second. So when you're stressed, what happens to the body is that your brain kicks in and tells your adrenal glands, hey, I'm stressed, kick out adrenaline, let's increase the blood pressure, the heart rate, and blood sugar, because then you're in that fight or flight. Well, in order to increase that, those things, sodium gets increased. So when sodium increases to increase that blood pressure, then what gets depleted is potassium and magnesium. And so that's where people can't calm themselves. And so then what happens is that then calcium is like, hey, I'm too stimulated and I'm in this, this acute stress state. Then that's when calcium starts getting pulled from the bones. And then it starts to go around the cell to be like, okay, I need to calm down because I can't keep taking that adrenaline and everything that's going into the cell. And that's where thyroid hormone can't get in, insulin can't get in, and things don't function as properly.
Well, one thing I find, thank you for that, Tammy. That was a very good explanation. And basically, if calcium, magnesium, which is good for mineralizing bone, you're going to have osteoporosis. So if you're on PPIs and you have a non-acidic stomach, because the PPIs raises the pH, and we're supposed to have an acidic stomach so we can kill the bad things in our stomach and dissolve minerals like magnesium and calcium and vitamin D, which is fat soluble. So under an acidic environment, it will be absorbed better. If we don't have that, then we get osteoporosis, right?
Correct.
And then what do we prescribe later on in life? After these people have been on PPIs for 20 years, we give them a biphosphonate, right? To make their bones stronger,
right.
Which is just, it's just ridiculous.
Right.
Or in your situation, when you had neuropathies, what would be the go-to drug for somebody with neuropathies?
Oh, there's numerous gabapentin or,
Right.
Lyrica, which then would drive, a whole bunch of other side effects. But yeah.
Right. So how many patients are taking PPIs and they have neuropathy and we're not really fixing the problem? We're just throwing another drug at them when in reality we need to get them off the PPI. PPIs are not meant to be used long term. They
Right.
are our stomachs are made to be acidic. So for anybody that's on a PPI, listen in because you should be able to get off those long term for sure. It's a not good to be on them.